You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the PBM Reform Podcast, where we dive deep into the world of pharmaceutical benefit management, cutting through the noise to uncover the truth. Since 2019, we've been your go-to source for the latest on how PBMs impact patient care, drug pricing, and the very future of pharmacy. Here, we champion the role of pharmacists, the most knowledgeable advocates for medication safety and expertise. Join us as we expose and generate discussions that are reshaping healthcare and explore how we build a better payment system which focuses on advancing pharmacy care.
Welcome to the PBM Reform Podcast here on the Pharmacy Podcast Network. My name is Breck Rice. I'll be your host today. We have an amazing opportunity to speak with Dr. Bobby Makamala today, who is the acting president of the American Medical Association, so the AMA. So, Dr. Bobby, so great to have you on the show.
Oh, it's good to be here, Breck. Appreciate the opportunity to have this conversation.
Yeah, and I was so looking forward to this, and I know we have a pretty short window of time here. You're a very busy man doing everything that you do there at the AMA. But number one, tell me more about your background. How did you get started? Where did you go to medical school? What made you want to become a doctor?
Yeah, it's not a standard wow, that's amazing type answer, but I'm an honest guy, and I'll just tell you how it went. My folks moved here from India when they were 25, here in Flint, Michigan, which is where I grew up and where I came back to practice. My dad's a retired radiologist. My mom's a retired pediatrician. And as far as, why I decided to go to medical school, I wanted to be a journalist, right? There was a guy named Peter Jennings back, you probably remember him on ABC, and I thought he was awesome. And I was like, I'm going to be like that guy. And I told my parents that, and they basically grounded me until I changed my mind. And so I said, fine, I'll go to med school. And I got into this program at the University of Michigan where you get in out of high school. And so, I was just sort of doing it to keep my parents happy. Then I started my practice, fast forward through med school, through residency, got married, brought my wife back home to Flint because it's been an amazing town. It's not the top of people's radar, unless it's like a water crisis or something like that, or General Motors moving out of town. But it's an amazing place to grow up. That's been so great to my family that I wanted to give back. So I started my practice and I realized, you know what, this is not as easy as it seemed in med school, where you know the science, but then you got to deal with things like pharmacy benefit managers, right? To try to do the right thing for your patients. And that's when I thought, this isn't right. And I got involved in organized medicine. And fast forward another 25 years, this is my 25th year in practice. And my day job, I just got back from the office, is I'm an ENT, so cleaning out noses, cleaning out earwax, taking care of my community. But when I operated this morning, when I prescribe something, I have to go through so much more than knowing the right thing to do and getting it done for my patients with pharmacies, pharmacy benefit managers, insurance companies, prior authorization, you name it. And that's when I started to get more involved at the American Medical Association. Now, here I am as sitting as its president, working on things like this with guys like you.
Well, that's an amazing history that you've had, and tell our audience what your actual practice is. What are you a specialist in?
Yep. So I'm an otolaryngologist, an ear, nose, and throat doc, and I share this office with an OBGYN, which sounds like a bizarre combination of specialists. They both begin with O, but that's about all they have in common, north of here and south of here.
Yeah,
but
exactly.
The reason that makes sense is that the person that I share the office with, I share this home office with, she sits right behind me here, and she's an OBGYN, and she's my wife.
Ah, wow, that's very convenient. That's excellent. So,
yeah,
well, you almost didn't have a choice to become a doctor. So that was you had wise parents, and we need more good doctors like you. So appreciate all the service that you provide.
Thank you.
Where does the overlap with physicians and PBMs come in? Because we all know on the community pharmacy side just how brutalized they are by the PBMs today, and how unfairly especially the community pharmacies are treated. Where does that overlap with the medical side on physicians and the PBMs?
Yeah, it's just so frustrating because, again, knowing the right thing to do, having the right prescription for the right ear infection that I see, and then having to go through an in between, right? Between the pharmacy that is supposed to fill my prescription and me who writes that prescription all of a sudden, not suddenly. I mean, it's been going on for a while, but it's pretty new. When I started my practice 25 years ago, we didn't have to deal with that. But the pharmacy benefit manager, the entity that's supposed to, decide what it is that can be done based on what I wrote and what the pharmacy needs to fill, is an in between. And that's just as if healthcare wasn't complicated enough in our country, where we have things like prior authorization, which I am used to for 25 years, and that kind of sucks too. But on top of that, now you see we got PBMs to deal with. And it just, when it's not clinically oriented, right? When it's financially oriented, and when it's not an independent decision that's being made, right? It's not like there's a third party that says, based on what we assess, this is what we would say. It's not like that, right? When companies that are in charge of giving the patient what we prescribe are also in charge of assessing the rightness of that prescription, that's just not right at all.
Yeah, that is, some might say it's practicing medicine without a license, right? You've got an in between that's making decisions and kind of overstepping what the medical provider is recommending.
Yep, absolutely.
Absolutely. Something that needs to change. So let's talk about change, because sometimes I feel like, PBM reform, even though progress is being made, it's a very slow process. I use the analogy of a little guy in a rowboat with his hammer and chisel chipping away at that iceberg before the Titanic runs into it. He's making progress. It's just not fast enough, right? And wouldn't it be better to somehow skirt around that iceberg instead of running smack dab into it? So what is the AMA currently involved in to help with changing that situation with the middleman today?
The AMA, well, we have an action plan. You don't just jump into action, right? We need to make people aware of the circumstances, right? I mean, you ask, if I tell my patients, you know what, we got a major problem with PBMs, they're gonna be like, what? Peanut butter and what? Right? So it needs clarification, right? It needs people to become aware, right? And it's the same thing the AMA does with everything, right? We want not just physicians to be aware, because we're knee deep in it, and for us to go to Congress and say, you know what, we really got to change this. Sometimes that's effective, but when congressmen hear from more than just the physician, right? When they hear from people that are, the people I grew up with, right? I remember my mom being a retired pediatrician. Man, she would get all sorts of office supplies from our locally owned pharmacy, right? And it was amazing, right? I mean, occasionally I would get some school clothes there because occasionally they had some school clothes and stuff, but it was that kind of relationship, right? And so when patients become aware of the consequence to our community and their care, when all of a sudden something like this comes in, and then the congressman hears from them in addition to us, that's how we become more effective at solving problems, right? Whether that's prior authorization, whether that's compensation for taking care of patients that's been stagnant for 25 years for Medicare, whether that's dealing with trying to take care of patients but having to deal with PBMs. When congressmen hear from we physicians and from patients, they're more likely to help with that problem. So that's the AMA's philosophy, is let's get people aware of what it's going to take to improve their care, and that we put a lot of effort into that, right? I mean, we give physicians resources to talk to their patients. We directly sort of talk to patients. We have 100,000 patients that are sort of in the inner circle of the AMA, where we know they're interested in how to improve healthcare, and we give them this data. And the data that we give them, I mean, we do our own analysis, right? I mean, you could Google and see the data about that, but much of it is from the American Medical Association. And, our market analysis, we call that, it just sort of adds to the growing concern based on the data. And so according to that AMA analysis, the 4 largest PBMs in our country collectively have 67% of the national PBM market.
Mm-hmm. Yep.
How bad would it be if a particular insurance company, right, that people struggle to get care with, had 67% of the market share of all healthcare. That's bad,
Yeah.
right? And healthcare a lot of times involves using some medicine. You know what I mean? I mean, when I operated this morning, every single one of my patients left there with a prescription for eardrops or antibiotic for whatever was going on that I took care of. And to have that decision about the rightness of what I prescribed controlled 67% of the time by 4 companies in this country, that just ain't right.
Yeah. You've added a PBM from the pharmacy side. It's the three big PBMs that they're dealing with, traditionally, which is, Optum, Express Scripts, and then CVS Caremark, right? Are
Yep.
the three big that the pharmacies are dealing with on a regular basis. Does the AMA, Dr. Bobby, ever get involved on the state level? There's a big issue going on in Arkansas right now with whether or not it's legal for CVS to own pharmacies since they also own the PBM.
Yep. Yeah. I mean, so we help states. I mean, this is what we call the Federation of Medicine, right? Where some things are at the national level, right? We got to go to DC. We got to talk to senators. We got to talk to congressmen about an issue. But so much of healthcare is affected by what happens in your own state, and somewhat even in your own community, but definitely in your own state. And that's not something. I mean, we have amazing state medical societies, state medical associations. Here in Michigan, we have the Michigan State Medical Society, the MSMS. I was just down in Mississippi last week with MSMA, right? And so each state has that kind of organization that the AMA helps, because that's who's on the front line in Arkansas, right? In Michigan, in Mississippi, in California, you name the state, it's the State Association of Physicians that's on the front line trying to improve patient care and make it easier for us to take care of our patients. And they don't have the resources necessarily to take care of this the right way, right? I mean, there's a lot of effort that has to get put in, and none of that comes for free. And so the American Medical Association is very involved with the data, with the resources, with the experts that share all that with a state like Arkansas that's going through this. So it's like left and right hands working together.
Okay, excellent. Well, what do you think is the biggest challenge today that that the AMA is helping to solve with PBM reform?
Yeah, I mean, I think it's it's the goal is for Congress to protect American patients and sort of take concrete steps to comprehensive drug pricing transparency. I mean, when that's all done, like the Wizard of Oz, right? I mean, no one sees him, but he's behind there doing something, right? And that's exactly what this is like, right? That lack of transparency. And so what we really want Congress to do is sort of to zero in on pharmacy benefit managers and holding them accountable. I mean, it's not something that there should be a get out of jail free card with this thing, right? When it affects patient care, when we want to do the right thing and they're getting in the way, there should be accountability for that. And so really Congress embracing legislative proposals, for example, that sort of prevent PBMs from engaging in these unfair and deceptive reimbursements, right? When that's all in the cloud, when if we do it this way, we're going to make a little more money as opposed to doing what's right for the patient. Again, something that's just not right. And so this is very much what the AMA is involved in, is getting Congress involved and trying to help us solve this problem.
But Dr. Bobby, though, so many of the dollars that are helping these lawmakers get reelected are coming from special interests that are attached directly to those PBMs. How do we really make new laws when when the lawmakers are trying to stay loyal to the people that are helping them get elected?
Yeah, this is a problem that applies to so much of what we want to do to improve the health of our country, right? I mean, the American Medical Association has an office in Washington, D.C., because so many of the things we need to do to promote the art and science of medicine and the betterment of public health, our mission relies on Congress to do things. And you're absolutely right. Many times, if your contribution to them doing the work that they do isn't as big as somebody else, naturally there's going to be some bias there, and that's a problem. But how do we deal with that, right? I mean, we have also being aware of what it's like to get stuff done. There is the AMPAC, the Political Action Committee of American Medical Association, separate group, but this is what they do, just like everybody else. But I really feel, I mean, like I said, my parents moved here from India. They're Hindu. I went to Catholic school 5 days a week. I'm just a confused guy, right? Both those things. But I know David and Goliath, right? Many people know that story. And
Mhm.
having that kind of discrepancy between our influence, knowing the right thing to do for our patients, and other groups' influence, I feel like David. We feel like David, and that's frustrating. But
Yeah.
what's amazing is that, like prior authorization, the example that I gave earlier, that's something that insurance companies, the same people with enormous influence, uh, lost here in the state of Michigan. And the American Medical Association does work across the country, every state that deals with that. Because when you put patient stories with what it is you're asking for, then the dollars don't matter so much, right? Because these are constituents, right? These are people whose stories are critical to the congressman that represents them. And so we have that behind us, right? We're the ones that become the voice of our patients so that people hear it, people that make decisions. And so it's not, luckily, just the size of the check, right? Which is wrong. It's the stories that help to make this country better, that will be very influential when those stories come from constituents, our patients.
Yeah, I've said it before on this program here on the PBM Reform podcast on the Pharmacy Podcast Network that I feel like our lawmakers should adopt the NASCAR jersey, where you could see who they're sponsored by. Oh, that congressman's sponsored by Pfizer. Oh, that one's sponsored by United Healthcare. It would be great to know who their allegiances are aligned with.
Yeah, it would make that Calvin Klein and Gucci suits have all sorts of extra stuff in addition to the CK and the G, huh?
Yeah, exactly. Absolutely. So, taking you back to your medical school days there at U of M, was Dr. Marshall Runge there when you were going through?
Yes, yeah, I know the name. But of course, that was between 1995 and the year 2000. Actually, I'm sorry, no, 91 to 95, last
Okay.
century. So
Well, he just retired, so he was the dean of the medical school there at U of M. Wonderful guy. Had him on a podcast before. Super intelligent, very nice. Wouldn't allow us to call him Dr. Runge. He wanted to just call me Marshall. Just really a humble, nice guy. But
he probably knew my name from that phase in my life where all I cared about was my grades and keeping my parents happy, wondering why they didn't let me become Peter Jennings and I had to be in this guy's medical school. Of course, I'm very thankful for that now. I'm what they call sort of apathetic back then, but very energized now because I want to leave this country better than I found it. And dealing with things like patients getting the things that we prescribe that they need, having to deal with PBMs is a big part of that.
yeah, so you bring up your parents again. I've got to ask you: do you and your OB wife have any children?
We do. We do. We have
Okay.
twin boys. They're 25, and people sort of look at me and they're like, "You got 25-year-old kids?" I'm like, "Yeah, we started early. I mean, they were born when I was 29, and so they're good kids. Neither one is pursuing a healthcare degree, which
Well,
is
that was going to be my next question. How do they get out of that? Don't grandma and grandpa have any say, and their parents have any say in this?
well, oddly, well, my folks forced me to go into medicine. Again, very much, yeah, I'm grateful for that.
No.
They were happy with my kids doing anything that they were passionate about, and I see that as the critical way to measure. I see people. I get involved in the community here in Flint, right? I owe it a lot. And when I see people pursuing things that they're passionate about, right, whether that's their neighborhood and revitalizing that, whether that's downtown, whether it's their family, whether it's their school, when you do something you love, nothing ever feels like work. And I can honestly say that about being the president of the American Medical Association. I got to travel 200 days this year. I'm flying to Washington, D.C. in a few hours. But it never feels like work when it's something you're passionate about. Again, whether that's gardening or whether that's improving healthcare, if you're doing something you love, it's great. And my kids both love what they're doing. One is going to be a PhD in political philosophy, and the other one is a biomedical engineer. And they
Wow.
love it. And every day they just grow. And they wake up, they do what they need to do, and they go to sleep well rested and are loving every day. What more can you ask for as a parent?
That is amazing. That is awesome. So tell me, is there anything we haven't covered in this episode that you think needs to be highlighted? And then I have one other kind of political question. Maybe I'll ask this one first, and then we can go back on a positive note. You've
Yeah.
been pretty vocal about what our new secretary Kennedy has said about vaccinations. Do you want to cover anything or clarify anything? Because you have been very vocal about that.
Yeah, I think yes, I have. The American Medical Association has, just because we're driven by science, right? I mean, I can't even count the number of hours at the University of Michigan that I spent at the dean's, in the classes and the residency, and still every day, looking on PubMed and reading about the research that improves healthcare, and that's what drives us.
Yeah.
And all of a sudden, to have decisions made about something like mRNA, right, an amazing way to keep people from dying the way they were dying from COVID, right? Because of mRNA vaccination. And it's not perfect. I mean, it doesn't stop you from testing positive for COVID, but it sure does prevent a boatload of deaths, right?
Yeah.
But all of a sudden to hear that from the Secretary, Robert F. Kennedy Jr., that we're not going to do that anymore. We're not going to study mRNA vaccines. We're going back to the traditional stuff that worked better. That's just not right. You know what I mean? I mean, when we first came up with our first antacid medication for ulcers, and it didn't work great, but it helped a little bit, to say, we're not going to do that anymore. Where would we be now?
Yeah.
Right. And so in the same way, when the Secretary of the Health and Human Services, right, a massive, influential, the most influential thing on the future of healthcare in our country, isn't based on science, but is more on the social aspect of some of these things. There's some people, when you say we're getting rid of mRNA, they're going to celebrate, but that's not based on scientific knowledge. That's taking something that should be in a textbook. No one uses those anymore, but should be on your screen in a 1,000-page thing that you read to learn it, instead of a small Facebook post saying this stuff doesn't work. Which do you rely on? You should rely on this one, right? The book, not the social post. But that's where we are, and that's why we always sort of make our opinion known, because it's an opinion that's based on science, not based on social stuff.
Well, I appreciate you sharing your point of view on that. And back to my other question then, is there anything that the AMA is involved in with PBM reform that we haven't covered that we should cover before we end?
I think we covered it in two very, different aspects that make it a wide effort from our communities in our hometown, letting people know what the consequences are if this continues the way that it is, and the frustration they'll feel as a patient, to Washington, D.C., where they have the most influence on improving the healthcare of our country instead of stagnating it or even moving it backwards. Whether that's mRNA or whether that's access to the medicine that we need for our patients, both of them, Washington, D.C. is front and center as far as influence. And so I would encourage everybody that's listening to this to get involved by contacting those people that need to be aware of what we go through in our communities, in our patients, in the health of our country, so they can do the right thing.
Yeah, well, I appreciate that, Dr. Bobby. And now, are you ready for the rapid fire? This is just to get to know you a little bit better. Just easy questions, just first thing that comes to mind. Are you more of an early bird or a night owl?
Oh, early bird. Usually, well, that's because I'm 54 now too, and I wake up at 4:30, even though the alarm is set for 5:30. But early bird.
Okay, excellent. And do you prefer the mountains or the beach?
Mountains. Yeah, I'm not. All the beaches I've ever been to, they all look the same to me. Sometimes it's water coming in from the east, sometimes it's from the west, but they all look the same.
Okay. And do you prefer coffee, tea, or something else?
Neither of those. I gave up caffeine about 15 years ago because a couple days I didn't have any Diet Coke, which was my caffeine of choice, and I got this massive headache. And right then I realized, oh my gosh, I'm addicted to caffeine. Didn't want to be that anymore, so I gave it up. And so now it's more juices and water.
Water, yeah, plenty of water, and a little bit of sea salt, right, to get your minerals, right?
That's right.
Excellent. Well, thank you so much, Dr. Bobby, for being our guest today on the PBM Reform podcast here on the Pharmacy Podcast Network. We've been speaking with Dr. Bobby Makamala, who is an MD and also the acting president of the AMA. And really appreciate you taking time out of your so busy schedule, flying around the country and running the AMA, and then your own private practice as well. It's got to keep you busy. At least your twins are now self-sufficient, right?
Oh, absolutely. Yep. They're good kids. It's nice to be called periodically. It keeps me happy. But no, life is good. And one thing I'll mention, Breck, my intersection with pharmacy is not just as a physician. 8 months ago, I got diagnosed with brain cancer. And so I had this massive operation in December, and it just turns out that the medicine that might keep me alive for a little longer costs $250,000 a year.
Wow.
Yeah, every day it's $900. And it's just one of those things. If I drop an aspirin, I'll just pick another one out of the container. If I drop a $900 pill, I'm washing it off. I'm still taking it. But it's just my intersection with pharmaceuticals. And to have the possibility that a pharmacy benefit manager is potentially involved. I mean, I don't think I have that problem right now, but who knows? Right?
Yeah.
Is potentially involved when there's more choices saying, you know what, this one, no, we got a better deal on this one. This is one we're going to do. What am I going to do as a patient? This is exactly what so many patients are dealing with already, and why it's important that we have this conversation. Sorry to bring in that, but it's a kind of a personal intersection with what we're dealing with.
I absolutely appreciate you personalizing this, and absolutely best of luck to you, and thoughts and prayers go out to you and your family that this all resolves the way that it's supposed to. Amazing experience that you've had. Similarly, my day job isn't podcasting. We do revenue cycle management for community pharmacies. We help them process their workers' comp claims. And when a nurse gets a needle stick and they need HIV meds, we don't need some middleman telling them when they can't get those. We need them immediately. And so we just step in and cover it, whether we're going to get paid or not.
Yeah, I mean, unfortunately, there's so many things in medicine that we do, like, just basically, trying to keep track of what we do, vaccinate people.
Yeah.
I mean, the compensation for vaccination is pretty darn low, but yet, just like you said, you do it because it's the right thing to do. The better solution is to have healthcare invest in those things that are good for the outcomes in our patients. And that's what we advocate for, but we're still going to do the right thing, just like you do, just like we do.
Yeah. Well, thank you so much, Dr. Bobby. It's great to have you on the PBM Reform podcast. And best of luck to you and your family. And again, you've been listening to the PBM Reform podcast here on the Pharmacy Podcast Network. Until next time, stay curious, everyone, and we'll see you on the next episode.